Last year, in an effort spearheaded by my colleagues on the Board of Supervisors, Supervisors Clark and Mr. Reed and Mr. Higgins, the county instituted a 10-point plan to mitigate Lyme disease in Loudoun County and established the Loudoun Lyme Commission. Through this plan, the county is focusing on disease prevention and education towards all groups. The county's website now displays a prominent link to the Loudoun Targets Lyme Initiative, which features an interactive survey and social networking resources. Most importantly, the Lyme Commission has created and begun distributing educational material directed at children, and is working with public schools, the local sports teams, and with volunteer groups to raise awareness about Lyme disease. In response, we have seen community awareness of Lyme disease drastically increase. The board is looking forward to continuing these efforts to educate the community and get the word out on awareness on Lyme disease.
There's a lot of things to learn. This could be very, very important, because if you know somebody who has Lyme, who missed it, and I can tell so many people call me and say, can you get me to see Dr. Short? Can you get me to see X or Y? Because the doctor, where they are, doesn't know it. So this is important. You may learn something here that will keep you from really having a very, very difficult time. So, Sean, we thank you and the Board of Supervisors, all the members of the General Assembly. Again, all the panel, thank you for having me. Thank you.
We'd like to move forward now with the question and answer period. We're going to start with the far left and we'll move across. And I'm going to first read the question and then allow the speakers to provide their responses. Carolyn, here are the questions for you and for Brody. There are just a couple for you, but know you will be asked more as the night goes on. How is it managing treatment and going to school, recognizing that both Brody and Maddie will probably be answering this on their own as well? I thought you'd give the perspective as a parent.
He actually stayed in school. He found it very difficult to be in school because he was sick, so even when he went to school, he would come home and we'd have to do more schoolwork. And a lot of days, we would get a call from the school nurse that Brody had a fever or a rash, and we would have to get him, go pick him up. But in general, we were able to manage Brody going to school and doing well in school. It just took more time and a lot of effort at home.
The hardest part for me was that I was exhausted all the time. I had a hard time learning new things in school, so I would come home and my mom would have to teach me concepts that seemed entirely new to me, even though we just spent hours going over them in school.
It varied day to day with me. Some days I would be able to stay all day at school, and some days I'd be able to only stay for one class. So it became really tough managing both, but I think it's improved, especially now. I've gone through treatment, and it was hard managing treatment and going to school at the same time, but I've definitely improved.
During pregnancy, I know you have references, but here we go.
Yes, I do actually have a significant amount of references, but basically, yes, we do think it could be passed in utero. Basically, that can happen through placental cord blood. I've seen in practice positive PCR testing, which carries both mommy and baby blood. We also have seen in studies over and over that blood smears from newborns can carry the Borrelia bacteria. That's not just the antibodies, that's actually looking at the bacteria under a microscope and seeing it. They found it not only in the brain, but also the liver and the spleen in the neonatal population.
Thank you.
Next recommendation. So for children under 1, we do not recommend any DEET-containing products, and obviously they're immobile, so less at risk for ticks, but certainly possible. For children between the age of 1 and 3, we recommend anything that has 10% DEET, because it is the best insect repellent that you can use. And then over 3, you can use up to adult levels of up to 30% DEET. And that is the best repellent that you can use, and it is safe for pediatric use at that level.
Can a diagnosis of Lyme be made from clinical symptoms? And I'm going to let Dr. Walsh answer this as well.
I think most people would agree that Lyme disease can be a clinical diagnosis, especially in an area where Lyme is endemic. So if someone does present with either a history of a tick bite or without, and has symptoms, fever, muscle aches, joint aches, anything like that, Lyme disease could be diagnosed with or without serology.
How did you know about Lyme disease before you were diagnosed, or what about Lyme disease, if at all, did you know prior to your diagnosis?
I personally knew very little. I had heard about it before that new dogs could get it or people could get it too, but I knew about it most because my mom's family is actually from Lyme, Connecticut, so I had heard the name before, and I thought it was a little bit ironic how I ended up with it. But I definitely didn't know the kind of effect it could have on someone's body. I didn't know that it could take an emotional, physical, and mental toll on me personally, and I definitely have increased my education and knowledge about this.
Dr. Goodfriend, how are schools handling students who find ticks on them?
The schools are an invaluable partner with us and with the community as we're trying to spread the word about Lyme disease and keeping our students safe from Lyme disease. So if any of you have a student in public school, you probably got a Connect Ed message this week talking about Lyme disease awareness. If you have a student in the elementary school, hopefully that student came home and there's the envelope with a green tick brochure. And then next month, they should also, the elementary schools, be bringing home the kids' activity page, the copies of which we have here. Those green brochures are also available in the middle and high schools, but if you're parents of middle and high school students, you probably have already realized that what gets distributed to those students and what comes home is a very different story. So we try to focus different efforts with the schools on those older children. We do talk to the school nurses about Lyme disease. The school nurses are independent from the county government and the health department, so we don't have any control over what they do. I think what their understanding is that it's important that the tick be removed. It's important that the parents be notified. I would ask if people have questions about how that's done in their own school to contact their school administrator.
Dr. Farrow, what if a parent sees a child with what they think is a bullseye rash? What should they do?
So, very common question, an excellent question. Picture's worth 1,000 words. It's very hard to describe this over the phone, and I've spent many evenings listening to descriptions. Nowadays with technology, I've received iPhone pictures and other things, but it's still very difficult. And so obviously we recommend a visit to our office as soon as possible. Typically the ECM, the erythema migrans rash, will increase by 1 centimeter per day, and it will be there by the next day. So if you see it in the evening, I usually ask the parents to take a picture, and I have at times tried to diagnose by photograph, but I really don't feel comfortable subjecting a patient to a long course of antibiotics until I can see them in the office. And it really is a fairly characteristic rash, and actually had one this morning, which I did report to the health department. Classic case, and it was my third patient of the day, and he had been bitten on April 28th and came in with a classic EM rash. And so that was, and the mom had taken a picture because she had seen it the night before and brought it in. And so that's the most common way that the patients present to me.
Fred, how can we remove deer from our property?
I think that question's been asked a lot. We've asked that question to the Department of Game and Fisheries for Virginia. Loudoun County has one of the highest deer densities in all of Virginia. And according to their estimate a couple of years ago, you could get rid of 90% of the deer in the county and really not have much of an impact on Lyme disease. The density is just so great. For some people, there's still a misconception of the role that the deer play in Lyme disease. It used to be called the deer tick, and I think in part one of the reasons they went away from that is that the deer were getting a bad rap. Definitely the deer are a source of food for the ticks. And there's also sort of the superhighway through Loudoun County of how ticks get onto anybody's property, but they don't infect the ticks. So definitely keeping the deer off of your property is a value. And there's some ways of doing that. One is, well, deer, if they're hungry enough, will eat most anything in your garden. There's some plants that they prefer over others, so it's important to not plant those that are going to particularly attract them. Also, if there's certain areas in regard of your property where you really don't want them, you can put up fencing the deer will not jump over. But more important for many people is not the deer, but the rodent population. It's the mice that infect the ticks, and it's the mice that are around people's houses. So even if you had black-legged ticks on your property, which no one wants ticks on them, if they're not infected, they're not going to cause Lyme disease. I know there's some information out front of ways that you can remove the ticks from the mice. But there are also important ways, both in the information we have and information that's available online at our website and the CDC, of how to make your properties less conducive to rodents. If we could do that, then we go a long way of keeping the ticks off our property. And then on top of that, and it's really tough for these 3 months of the year, if we can dress appropriately so the ticks can't get on us, wear insect repellent, and do our daily tick checks, we really go very far towards helping to mitigate the chance that any of us will get infected with Lyme disease.
Kathy, what should we do when we encounter dismissive doctors?
Hot off the press. Well, I think this is a disease, I think, that, I mean, as Tara reflected, there's a lot of mixed understandings, and it's incumbent upon all of us to learn, to be educated, to engage in discussion, and as you know, as a parent advocate, the thing is incumbent upon me is that if you're not having a satisfactory experience with your doctor, get a second opinion. There's no reason to be angry, upset, accusing. Work with your doctor, talk to your doctor. And if you need a second opinion, go and seek them out.
I'm going to ask both Brody and Maddie their perspectives. Have you as students encountered problems of obtaining accommodations, 504, IP, etc., and any suggestions in dealing with resistant school personnel?
I myself have an IEP, and I just received one last year, I believe. I've had a 504 from 7th grade into 9th grade. And it was very hard to get that. There's a lot of testing that I had to go through, not only during the school year, but during the summer, and at home when I was not in school. So it's a very long process to get a good education program that's fit for you and for your disease. And I personally have found a lot of teachers that don't always agree with you when you're sick. They don't always think that, oh yeah, she's fine, you know, she can get her work done. Well, it's very hard to manage work and treatment and being tired all the time. Some days it does take me, hours to get through one worksheet, and with my IEP it's been easier. I have extended time up to 100%, which means that I can take as much time as I need to complete the assignment, especially if I have gone to a doctor's appointment or had a treatment. So it's made it very easy, and it's also helpful when you can come to your teacher with literature saying, this is what my disease is, here is more information on it if you want to read about it, if you want to be more informed. And I think that's really helps making sure that you inform your teachers as well.
I never really encountered a teacher that was resistant or anything like that. I never had problems because my family sort of kept it on QT. We kept it on the down low. We didn't really feel the need to tell the teachers unless it was absolutely necessary. And I think, didn't you send a letter to the middle school saying that I had one? And my teachers never asked me about it or anything, so I never had an issue with it. So.
Dr. Walsh, can you talk to how antibiotics treat or don't treat other tick-borne illnesses, and just the perspective of what antibiotics are there, how specific or not some may be?
There are different classes of antibiotics, and some are called cell wall inhibitors, and some are called intracellular antibiotics or protein synthesis. Antibiotics that inhibit protein synthesis. So in Lyme disease, usually people will use a cell wall inhibitor or an intracellular antibiotic. For the co-infections, there's a whole host of them, but those are usually intracellular infections, meaning the bacteria, the parasite are inside of different cells. So the thinking is usually if you pick an intracellular antibiotic, you can actually treat Lyme disease and the co-infections, and usually using more than one antibiotic or mixing it up, you have less chance of developing a resistant bacteria or parasite.
Well, the schools have come up a lot, and I think in our parent group and certainly in our own family, working with the schools is something that is really important. At this point, some schools understand what's going on with the disease better than others. There's still some schools who will think a child just has school phobia, or it's all in their head, or they're just lazy. But because the disease, sometimes the first inklings of it will be that a child's not learning well, or there are behavioral changes, or they're just fatigued, they can't sit up in class, they're having chronic headaches, and that can be misconstrued as a lot of things. So, that's something that has to be understood better by the schools, and then when the diagnosis occurs, then it becomes a special ed situation sometimes. And this is a discussion we just had among our parents, and it's one place. I think parents have the capacity to be game changers as far as education in this disease, because knowledge is power, and we are the ones that are interfacing with schools, with coaches, with our communities. And we had a situation in our group where a coach was having their kids sit in the grass in an unsafe area, and the parent contacted their sports league and talked to them about Lyme disease, and the next thing, it was in their newsletter, and all their coaches and all their parents were being educated. And I think this is, the Loud Lyme Initiative is an attempt, by the Loudoun County Board of Supervisors to get more information out there. And parents need to understand it's a transition time. The information is not out there in many cases, and sports leagues are a good example of that.
Are there any new tests on the horizon that can reliably detect the presence of Borrelia spirochetes in the body? There are some new tests that have not been consistently shown at this point, although there is suggestion they may be helpful. I think they may not be ready for prime time. There's a culture, there are some immune activity tests, but personally, I don't think that they've been consistent enough for us to rely on them as the question suggests.